What's going on? Happy Wednesday. We're going to talk about how to know if you truly have an Achilles tendinopathy. And we're not going to use the term tendonitis, guys, because tendonitis tends to refer to inflammation, and that's not always what's going on with an Achilles tendon issue. So if you're a runner tuning into this, if you're a weightlifter, if you're a basketball player or volleyball player, this is going to be just for you. Okay, so why are we going to talk about this? What are we going to talk about? We're going to jump right into it tonight without waiting or any hesitation. I want to make this a quick one. So we're going to talk about where the pain is located. Is super important to knowing how to diagnose the issue properly. And that's why we're talking about this big topic for tonight. There are 3 different types of tendon injuries for the Achilles tendon located on your ankle there. Number 1 is a mid-tendon injury. Number 2 is an insertional injury. And number 3 is a peritendon injury, which is a little more rare in existence. So number 1, if we go backwards, we're going to talk about mid-tendon injury first, because this is usually the most common one that you're going to see, especially from runners, basketball players, and volleyball players. It's usually seen in those 3 groups. Usually it's from overload of tensile forces, meaning like it's just being stretched like a rubber band too frequently. And usually what happens is that low tolerance set point of how much load that kind of Achilles tendon can handle on that mid portion is exceeded. To do too much volume, so too much sets and reps during your workouts, or too many plyometric jumps, or too much intensity, meaning too much weight thrown at it all at once in a short period of time. So super important, keep that in mind. That's mid-tendon injury for number 1. Number 2 is insertional injury. Insertional injury is a little more rare, but it's the second most common after mid-tendon, and that's localized to where that tendon attaches to the heel. Okay, so it's right where it inserts on the calcaneus, which is the word for the heel bone, or the anatomical term, I should say. And that's from a combo of that tensile force, like we just talked about for the mid-tendon injury, but not even just that, but it's also a combo. It kind of mixes with a compression too. So think about compression, right? Things kind of pushing together, so from stretching, and that's why with an insertional injury, with pain at that heel or close to the bottom of the foot, you want to avoid stretching, because stretching is actually going to make an insertional injury a lot worse. Okay, so keep that in mind. Loading the ankle in dorsiflexion, like in a half kneeling position, like a squat, a lunge, running up hills, those are all going to be very painful things to do. Even walking on the beach, sometimes that can be painful as well. So super important for insertional injury. And then the third one, which again is a little more rare, is called peritendon injury. Peritendon injury just means that it's the thin sheath that surrounds the kind of tendon of the Achilles. So it's almost like a protective kind of outer sheath there, and it's very thin, and that's usually caused by constant friction of the Achilles tendon rubbing against that sheath during any type of movement. So usually it's around kind of long endurance bike rides, long endurance runs, like a 5K, maybe doing a marathon. And it's usually diagnosed by hearing like crepitus. And all crepitus means is it's like cracking or popping. Okay, and it can be a bad thing if you hear that and you have some pain associated with it, then it's most likely located to a peritendon injury. And you want to get that addressed immediately and see an orthopedic physician or see a physical therapist or chiropractor for that. Okay, so why is it important to know those 3 different things? Because it's important to know those because it's going to dictate how you treat it. Because all 3 of those should be treated differently. Like you should not do any stretching for an insertional injury if you have pain on that kind of heel. Right? That's going to actually make it worse because you're going to apply more compression there, and it was caused by compression. So why would you compress it further and make it a little bit worse? Right? You want to avoid that. Mid-tendon injury, we're going to talk about next week, and peritendon injury, same thing. But obviously with peritendon, you want to avoid kind of doing those long endurance runs and give that Achilles tendon time to heal and recover and kind of replenish in a way. Okay, so we're going to finish up with talking about how do we diagnose these. Yes, we know for number 1, a mid-tendon injury is that kind of area of 1 to 3 centimeters above the heel. So it's kind of that mid portion of the Achilles. I'm not going to lift my leg up to show you guys right now, but that would probably be helpful. I wish I had a model to show you. Maybe we'll share something with you here in a second. The second one, insertional, is going to be at the bottom of the heel. So if you have pain there, it's most likely insertional. And then number 3, peritendon, is kind of on the outsides of the tendon, or a little bit deeper inside. All right, so how do we kind of diagnose these things? Lay on your stomach with your leg hanging off the edge of a bed. Have your friend squeeze your calf. It's called the calf squeeze test. If your foot moves, that's a negative sign. That's a good sign. That means your Achilles is intact and it's working. If the foot doesn't move, it means there's some kind of disconnect between the tendon and the calf muscles, meaning you could be experiencing a rupture. You most likely wouldn't be walking if you had a complete rupture. You would have a traumatic incident where you felt it really become painful. Okay, sometimes a complete rupture isn't painful, it just depends. And I know that sounds confusing, but we'll save that topic for another day. Okay, so that's number 1. Number 2 is you want to kind of train, or not train, but you want to diagnose and see how people tolerate, tolerate a load test, right? So it's called a load tolerance test. So you want to give patients or your friend, whoever you're trying to diagnose, maybe yourself, a scale of 0 to 10. 0 is no pain at all. 10 is very severe pain, like emergency room. So you want to rate each of these on that scale of 0 to 10. So number one, you're gonna start with a double leg normal heel raise off of the ground. If you don't have pain with that, you're gonna move on to a single leg heel raise off of the ground. Okay, and you're progressing these if you do not have any pain with them. If you don't have pain with those two, you're gonna do the same sequence, but you're gonna do it off of a step next. You can do it off of a stair, that works just as well. You wanna hold on to railings or something in front of you. It's not about balance, it's about load and about how much your Achilles tendon can kind of tolerate. I don't know why I can't say that word tonight, I apologize. So if you have any pain with those, then what you're gonna do is you're gonna think about it and you're gonna say, I had pain with my heel hanging off, but no pain with my foot on a flat surface doing a heel raise. Why is that? That means you have an insertional Achilles tendon injury. Like I said before, if you stretch that and put it into dorsiflexion, you're gonna be putting more tensile force on it and compression, and then it's gonna hurt more. So if you had no pain doing heel raises, single leg and double leg off the ground, but you did with your leg hanging off the edge of the step, then it's most likely insertional and that pain's gonna be around the heel. And that means you wanna avoid stretching at all costs of the calf muscles, right? No calf stretching, at least for a temporary amount of time while it recovers and kind of regrows and repairs. If you had pain off of the ground, then it's most likely a mid-tendon injury. It's gonna be in that area of 1 to 3 inches above where that heel is. Okay, so hopefully that makes sense. If it doesn't, comment down below. I'm happy to kind of explain a little more in detail. Okay, so the third and final test is the half kneeling 5-inch wall test. I use this with every one of my clients who has an ankle, a knee, or a hip issue. Or if they have a low back issue, I use it for them too, because a lot of times, like, people have tight ankles and you want to see if it's really the joint that's stiff or the calf muscles or the Achilles tendon. It could be all three. That's why this is a great test to do. And the way it works is you want to kind of go into a half kneeling position about 5 inches from the wall, so you can use your fist and your thumb. That's about 4 to 5 inches, or you can grab a tape measure if you want to be super kind of strict and precise with it. And you're gonna just try and touch your knee directly straight to the wall. You wanna try it with your knee over your big toe to the wall, and then with your knee over your 4th and 5th toe. And kind of compare those and see like where you have the most motion, and you wanna measure how far your knee is from the wall if you can't touch. You should be able to touch with both knees. If you can't, you have a tight Achilles tendon or calf muscles or a tight or stiff ankle joint. Okay, it's important to know if you have pinching, sharp pain, or discomfort with those two, and then contact your physical therapist and tell them kind of how you felt doing them. But this is a great test to do as a diagnostic test before you start your exercises or your workout, and then afterwards. If you're doing the proper exercises, you should go from not being able to touch the wall at the beginning to being able to touch the wall at the end. Right, really 3 simple tests. Calf squeeze test, just to review, is number 1. Scale of 0 to 10 pain test, heel raises off the ground, testing your tolerance to load. And then number 3 is a half kneeling dorsiflexion test, okay? Sometimes there's a biomechanical dysfunction too, where you just have weak glutes, like your glute max and your glute med muscle can be weak, so it could be hard to do like a single leg deadlift or a single leg pistol squat. So keep those in mind too. We're not gonna dive into those because it would take too long to go into it. But we're gonna talk about how to treat these 3 different injuries next week on our video, so stay tuned. Thank you guys so much for watching. If you found this valuable, hit that like button below, hit the subscribe button. We really appreciate you watching. And please guys, all I ask is that you share this with one other person. If you're a runner and you're watching this, you most likely know another runner who had Achilles tendon pain or some type of ankle issue at some point. So, do them a favor, share this with them. If you have questions or they have questions, feel free to reach out to me and I'm happy to answer them for you. And I'll see you in the next video. Have a great rest of your night.